Study out of UW-Medicine shows women still make less than men in the healthcare industry. Globally, women face a 24% gap across the healthcare sector. It's about 22% in the U.S. KOMO's Kelly Koopman spoke to one researcher who says there are opportunities to narrow the gap.
This study out of UW-Medicine focused on people who work in healthcare across multiple occupations and education levels. The key takeaway, the wage gap continues in health jobs, as it does across the rest of the economy, with women still making less than men.
Sometimes up to 60% of the level of wages that men are making, so 60 cents on the dollar, in some of those high-level education jobs.
Bianca Frogner says over the last 20 years, the wage gap has narrowed at higher-level education jobs. Think physicians and pharmacists, as more and more women enter those types of jobs. But the gap has widened in jobs requiring lower education levels, like home health aide or nursing assistant jobs, as more men have entered those positions. The key to narrowing the gap, having more women in the health workforce and being thoughtful about their wages.
As men are entering these jobs, that perhaps that they are coming in with stronger negotiating skills than women may be having, in part because they may be socialized to ask for more wages when they're entering.
Frogner adds, as men enter those jobs, they're given opportunities for leadership and management that women may be left out of.
Just by having the presence of more women isn't enough. We need to make sure that we're taking action and be thoughtful about wages as people are entering the workforce.
Kelly Koopman's KOMO News.
The study also looked at the wage gap for people of color. It found Hispanic women earn just 57 cents on the dollar, and black women earn 64 cents for every dollar earned by a white, non-Hispanic men.
Some residual delays due to that ground stop that happened earlier this morning. A new study out of UW-Medicine shows women still make less than men in the healthcare industry. Globally, women face a 24% gap across the healthcare sector. It's about 22% in the U.S.
Kelly Koopman spoke to one researcher who says there are opportunities to narrow the gap.
Bianca, thank you so much for joining us. You know, you and your team looked at the wage gap between men and women and how it has changed over the last 20 years, specifically when it comes to the healthcare workforce. What were some of your key findings?
Yeah, thank you so much for bringing up our study and taking some time to learn about it. Our study really focused on the health workforce across the board, multiple occupations, multiple education levels. And I think a couple key takeaways from our study are that the wage gap exists in the health workforce, much like it does in the rest of the economy between men and women, and such that women are making less than men, sometimes up to 60% of the level of wages that men are making, so 60 cents on the dollar in some of those high-level education jobs. However, the wage gap has been closing over time with more women representation. On the other end, though, as more men are entering some of our especially low-paid jobs that require less education, we're seeing some of those wage gaps worsen.
Let's dig into that part a little bit more, because you looked at everything from bachelor's degree, master's degree, high school degree. How did it vary in there?
Yeah, so where the wage gap has been worse are those jobs that require a higher level of education. So think about your physicians, your pharmacists, people who require a doctorate degree level education. That's where we see the wage gap the biggest between men and women. However, women have been entering those jobs more and more over the last 20 years. And as a result, the wage gap has reduced. On the other end, however, women play a significant role in jobs like home health aide jobs or nursing assistant jobs that only require a high school degree in order to enter those jobs. And in those jobs, men have been entering those jobs, but as men have been entering those jobs, women have been seeing their wage gap increase such that they're making less than men increasingly over the last 2 decades.
And what does this mean for the larger picture of where we stand in terms of the wage gap and how we move forward?
It's a good question. So, I think one of the key things about this study is just noting how important women are to the health workforce, right? Healthcare provides really good jobs for women across the educational spectrum in multiple settings, different kinds of titles. However, we can't take for granted that just having more women, more representation in the workforce just solves our problems of the wage gap. Just by having the presence of more women isn't enough. We need to make sure that we're taking actions and be thoughtful about wages as people are entering the workforce. I think the concern is that as men are entering these jobs, that perhaps that they are coming in with stronger negotiating skills than women may be having, in part because they may be socialized to ask for more wages when they're entering, which is contributing to the wage gap. The other concern is that maybe as men are entering these jobs, they are also given opportunities for leadership and management, and that as a result, women may be left out of those opportunities. Again, opportunities that may be leading to higher wages.
Okay. Well, Bianca, thank you so much for your time today. Appreciate it.
Thank you so much.
Oh, that was such an insightful interview. Historically, men have made more than women when it comes to employment in all walks of life and all jobs. Of course, it would apply to the healthcare sector as well. It's still, though, in 2024, it's disturbing to hear the big wage gap that still exists between men and women, again, in all aspects of employment, but especially, too, in healthcare.
It's shocking, and a lot of the times we do the same job, maybe even work twice as hard than the men, because, girls, we run the world.
That's right, yes,
but
yes.
you mentioned all industries. I know a lot of the talk in the news lately has been about the WNBA and their significant wage gap, seeing what Caitlin Clark is going to make compared to maybe some of her male counterparts in their rookie years.
NBA player, yes.
It's really interesting. But I hope, we all hope for change, right? So it's good to hear that those researchers are working toward that change.
Yeah, and I guess, it was good to hear kind of a little perspective as to what can be done, because in my mind, okay, well, how do we solve this problem? Like, we've been working on it for so long, what else can be done? And she did point out, too, maybe men are coming in with stronger negotiating skills, they have more knowledge in that. Well, we've got to get the ladies up to that level of a negotiating skill as well. So I do like to think of, how do we solve this issue? Give me some tangible ways to